Hello and welcome to the tip of the day. I'm Dr. Amy Starr with the Mesa Veterinary Clinic, Paws and Hooves Mole Veterinary Services, and San Francisco Stables. We're helping El Paso help their pets. So today I want to talk about restrictive cardiomyopathy in cats. So restrictive means that we're restricted. We're not able to open and close easily. Cardio means heart. Myo means muscle, and apathy means disease of. So it's a disease of the muscle of the heart that makes the heart not be able to open and close like it should. It's a disease that happens in cats usually around middle to late age. Not extremely common, but it is very severe when it happens. And so I'm gonna flip the camera around just a little bit so that you guys, we can discuss this and you guys can see it with the writing the right way. And then we'll discuss the actual disease and what we can or cannot do about it. Okay, so here we see that it is called restrictive cardiomyopathy. It happens in cats, again, middle to late age. It can cause lethargy, which means tiredness and not enough energy. It can cause poor appetite, weight loss, cachexia. Cachexia is where we see muscle loss. Basically, the weight loss is so severe that the body has no fat to eat up anymore, so it starts eating up or utilizing the muscle for life and energy. And so that's cachexia. So we start seeing severe weight loss and even muscle loss. We can see fainting, panting, open mouth breathing. We can see weakness or paralysis, depression, which again is similar to lethargy. They just don't have the energy. They're so weak that they don't really care about anything. They don't want to eat, etc. And then we can see heart murmurs, blue membranes, fluid in the lungs, fluid in or backup of the liver, so we get an enlarged liver, fluid in the abdomen, and other symptoms. And so basically what happens here is this is a diagram of the heart, and so blood comes from above the heart, so from the body above the heart, so from the head and shoulder area into the right atrium, and from the whole rest of the body below the heart through the vena cava again into the right atrium. So we have a cranial vena cava where the blood comes from above, and a caudal vena cava where the blood comes from below into the right atrium. All of the right side here is deoxygenated blood. That blood has no oxygen in it. We have the blood coming from the right atrium through a little valve into the right ventricle. Now, this disease causes scar tissue to build up in the ventricles, and that's how it causes the restrictive process. So basically, the scar tissue builds up in the right ventricle and causes that right ventricle to not be able to expand. And so what happens is as this blood comes in, it can't expand enough, it can't stretch to take in all of that blood. So we start getting a backup, and that backup is seen as an enlarged liver and a fluid in the abdomen, because that's where the blood is pumping from to go into the right atrium. And so it can't stretch to take all that blood in, so we get those symptoms. And then it also can't contract enough because of the scar tissue. It's no longer elastic, so it can't open or contract enough to pump the blood out to the lungs. So from the right ventricle, the blood gets pumped out through the lungs so we can get that blood oxygenated. And so not enough blood is going to the lungs to get oxygenated. Now, from the lungs, the blood gets pumped back into the left atrium and then through the little valve down into the left ventricle. Again, this ventricle has scar tissue in it, so it cannot stretch enough to receive enough blood from the lungs, causing it to get backup of fluid into lungs, which is then called congestive heart failure because we start getting fluid buildup in the lungs. So we start seeing coughing. On x-rays, we'll see the fluid on the lungs. We can see some wheezing or just the lethargy. You know, if you've got fluid in your lungs and you can't get enough oxygen to your brain and your muscles, then you're going to start being lethargic and depressed and weak and maybe even paralyzed. So the blood comes from the heart, from the lungs, into the left atrium, down in the left ventricle. We can't open enough to get enough blood. We also cannot squeeze enough to get that oxygenated blood out through the aorta to the rest of the body. And so again, we have not enough oxygenated blood going to the rest of the body, causing those symptoms that I mentioned. And so this is a very serious disease. We have no way of knowing if the pet is going to give it. We have no way of preventing or predicting that. And unfortunately, cats are really good at hiding symptoms like that. They basically just kind of restrict their activity. They hunker down and keep their elbows kind of open, and so they can try to expand their chest so they can breathe better, but they just are a little bit quieter. So unfortunately, it's hard to tell that cats have this until it's quite severe. There is no true treatment. The way we find out if cats have this is with an echocardiogram, which is an ultrasound of the heart, so we can see that thickening of the ventricles in the ultrasound. Obviously, there are tests that are done before that to figure out, if it's something else. So we take blood work to see if the liver enzymes are elevated, so liver disease from that fluid backup. We do chest x-rays to see if the heart is enlarged, if there's thickening in the heart, or if there's fluid buildup in the lungs. We also, want to look at the abdomen, maybe do an ultrasound of the abdomen to see if there's fluid in the abdomen or if that liver is enlarged and congested. But in the end, the true only diagnostic we have is of doing the ultrasound of the heart. Unfortunately, like I said, there is no actual treatment for this. We can definitely give medications to make the pet more comfortable, to reduce some of that fluid buildup, to make the heart function a little bit better, and help them out. But unfortunately, there's no actual treatment for this disease. So really important to kind of keep a really good eye on your cats because they are so good at hiding problems. We want to, if you see any change in activity, if they just seem a lot more quiet, they don't want to move around as much, they kind of hunker down, in the corner and kind of keep themselves compressed as quiet as possible with their elbows out. Or definitely if you see any open mouth breathing, panting, fainting, weight loss, weakness, things like that. Really important to have your pet diagnosed as quickly as possible so that we can get them the medication that will keep them as comfortable as possible and prolong life. If you have any questions, let us know, and I hope everybody has a wonderful day.